Hello, I'm Dr. Dan Hale, co-director of the Congregational Depression Awareness Program at Johns Hopkins. Today, I have the wonderful opportunity to talk with the Reverend Dr. Jeffrey Sumner, a minister I met more than 25 years ago as he and his church were embarking on a new ministry. So good morning, Dr. Sumner, and thank you for taking the time to talk with me today.
It's a pleasure to join you for a topic that I have a keen interest in, as do you.
Good. Well, I'd like to start by having you tell us a little bit about yourself and your church, and particularly this health ministry that you began.
Sure. Well, I came to Westminster by the Sea a long time ago in 1985. It was a different church that has grown over these years, but it was a difficult and a struggling church in some ways, and there were conflicts. So I'm married for 43 years. I have 3 grown children with spouses and 4 great-grandsons. But in 1987, I really was struggling with some of the issues in the church and nearly burnt out and maybe even called it a dark night. So that just planted a seed of almost getting to the precipice of leaving ministry or doing something else, because it was such a sense of despondency during that time. I got past it, but I plugged that into my memory banks. And as I came into the 90s, I heard about your program bringing medical and religious partnerships together, that what you originally called Project Reach. And one of our church members came to some of your early trainings, and I believed that this was a valuable ministry for a church and very viable outreach for hospitals or other health communities. So I encouraged my church member to come and be a part of that and bring back the information. And the church has kept growing, and I've become more aware of people's issues, because the longer you stay somewhere, you get to know the people very well. And so I have some insights that help them. And so I was pleased to know that you were beginning to work in that area called Project Reach.
Good. Well, I know in that program you cover many topics, and you've done a great job of working with the local health scene to bring in professionals. I'm particularly interested in how you've dealt with the topic of depression. Can you say something about that?
Yes, I'm just going to piggyback on the Project Reach. We developed a program in tandem with you that we call Body, Mind, and Soul that's been going for almost 25 years. It doesn't need funding for the church because we pull in medical experts. They can be psychologists or psychiatrists or ophthalmologists or oncologists or nurses or chaplains. We pull them in and say, we have built a trusting space for our health ministries. And because you're not selling anything and we're not paying something, the trust level goes up, that what the medical professionals or the religious professionals are sharing is not bending toward greasing a palm or trying to sell a product. So people come and they let down their guard better for all of these topics. Now, the idea of depression has certainly been a part of my experience, my experience from family members and my experience from congregation members. The depression that I have been aware of can sometimes lead to severe hopelessness and a sense of bleak outlook on life that leads to despondency. So as I am I should say, as I observe congregation members or others who seem different, and I'm aware, maybe aware of a situation in their life that may have knocked them off track, then that's what it raises my awareness with them. And I seek out ways, sometimes in a hallway, sometimes in a phone call, and I say, it seems to me that something different is going on in your life. I'm inviting you to share it with me if you're willing. I try not to do a yes or no answer because I can just say no and walk away. I try to say, can you tell me about it? So that they might say something about it. And that kind of brings an under the surface topic to the surface.
Well, certainly it's important that you've been there for a long time and people know you and trust you. But I think around the issue of depression or other mental health conditions, there's a lot of reluctance. So I know you must have done something to sort of create a safe, secure space for people to speak to you. And so can you say a little bit about what you've done that you think really has given people that welcome them to talk to you about depression?
Well, I think it has been two things. When we do our announcements on a Sunday morning, we include the announcements about the Body, Mind, and Soul Health Ministry. And so people are used to hearing about many medical topics. And then I bring up the topic of depression. And I say, this is a safe place to have this addressed by a professional. And you, or maybe someone you know, has been affected by depression. It may not be that you feel like you have depression. It may be that you have someone who you think would benefit from hearing this. And so it gets people to bring in family members or friends and doesn't make the target seem like it's right on them. Sometimes when a preacher preaches, they feel like the preacher is identifying their particular sin or their particular weakness, and that I get calls or text or email says, you are speaking right to me today. So I try not to go directly because some people really don't want that identification that they have depression. So I say, maybe one of your friends or family members, and then the person with depression may come along and hear the information and speak either with me or with the professional. And that's the part two of the answer. I was pleased to be part of a board of directors for a ministry that was in its infancy in 1986 called the Presbyterian Counseling Center in Daytona Beach. And we started with one therapist and then three therapists, and currently have 7 locations in Volusia County, and we have 19 therapists, one of which we are planting on the campus of Westminster by the Sea. So I not only let them know these are professionals, they can come and speak with me, but I will say to them, when I sense depression and not just a bad day or another kind of light issue, I'll say, I'm a generalist. I triage things, and in triaging, I think this needs other care than I can give on a weekly basis. So I'm going to provide the name of a person, and I will provide the payment for 3 sessions, because sometimes the payment is frightening for people, so that you can give it a try and see if you feel like it's helping. And then I'm going to walk alongside of you, not in the sessions, but be here and say, how did it go? You can always change a therapist, like you change a tire on a car. If that's not the one that you want, try another one. So I try to break the ice by giving them options to deal with what is a brutal situation in their lives.
I'm curious, if you don't mind my asking, you mentioned earlier that there was a dark period in your life. I don't think you said you were depressed, but you were in that direction, let's say. Is that something you share with others? And if so, does that help give them permission to share some of their dark periods, dark experiences?
It does. I'm reluctant to call what I went through depression, but it had similarities of characteristics, I would say. I named it Dark Night and I've called it burnout. But when I got to do my Doctor of Ministry stage in my life, and I was working on my, what some would call dissertation, but Columbia Seminary called it a project. I said, I know what I need to work on. And they said, no, you need to ruminate on it and you need to think about it and you need to research it. I said, no, this has stayed on my shelf since 1987. And I want to call it Discovery in the Dark Night of the Soul. And in doing this project, I needed well over 100 hours of interviews of Presbyterian ministers in the area and elders and some of our own congregation members. So I said to them, I'm doing this project and it has to do with any time when you may have felt a kind of darkness. And I just felt like naming it darkness rather than going for depression or burnout, or I think I didn't want to diagnose it before I did the research on the paper. So I said darkness, and people came out of the woodwork. Maybe because it was the topic, maybe because they knew me, but I had one person, it was a female clergy person at Presbytery, say, I was ready to leave ministry, but your invitation for me to talk to you has given me hope again, and I can hang on and discuss this, which we did for several months. So that is one thing that I did to allow people to speak to me, and this issue was so crippling that I really was thinking, what else could I do in the world? Can I deliver mail, which would have been a horrible thing now, but at the time it thought, don't have to deal with people, don't have to deal with all of the outside world, I wouldn't think. So I was just grasping at straws. And I have preached about that from the pulpit to let them know that I had this horrible time. And I did a series of 6 sermons called Life on the D List. D as in dog, but D as in depression too, and D as in darkness, and all of those. And so I did a whole series in saying what that D list is. And I've kept those along with my dissertation, because I never want to forget that there are other people who also, especially at a time like this, will be struggling with one of these issues that might be able to be addressed, especially the issue of depression.
Thank you. That I so appreciate what you've done and your willingness to speak about your own experience. I guess I just want to ask, do you have any additional advice for pastors or lay leaders who want to do something in this area of depression awareness?
Well, I would first of all say that I choose to bring up the subject of depression in worship, which is our main gathering time of the community of faith. Generally in announcements and in prayers. I haven't really preached on depression. I have, in that Life on the D List, mentioned, I try to be a biblical preacher most of the time, and I mentioned Elijah, who was being chased by Jezebel, and he went into a cave. Maybe it's symbolic, maybe it's actual, and God found him in that cave, and he was feeling spent. He was feeling despondent. So I don't know what to name that, and I was reluctant to say Elijah was depressed, but Elijah was facing something. So I have preached about those things, but for example, I pulled this out from one of my prayers. It says, as we are offering prayers for people, for those suffering from debilitating depression, help them to know that there is truly light, not just everlasting darkness. Help us to offer hope. So my prayers kind of plant the seed that I'm not calling you out in a sermon, but I know that people that are going through something like this are in our presence. So I do that. But the health ministry, how should I say this? In a church, there are really some things in a congregational, in a worship setting, that people don't want the preacher to know. They don't want the preacher to know about their sins. They don't want the preacher to know about their weaknesses. They try to think like they are blending into the woodwork, and that I'm preaching to other people instead of to them. So I don't find it conducive to saying, let me talk about depression today, because people will feel like they've got a scarlet letter. How does he know that I have depression? So I tend to talk about it circumstantially and educationally. So I say, we have this venue that is very safe. There's no cost. And we just invite you to come. There'll be some light refreshments, and there'll be an expert in many different fields, as I mentioned, but certainly on the field of depression. We had the director of our Presbyterian Counseling Center come several times. We've had chaplains come. And so I want you to know, whoever is listening to this, that this kind of ministry is pretty much at your doorstep. It is a ministry that gets people through your doors at a church that may never come for a religious service, but maybe they want that. They just want a side door in which to enter. So this body, mind, and soul, you may call it whatever you wish, is something that gives them wonderful, non-threatening information that invites them to take the next step that they may need for either talking with me as a pastor or a therapist, or talking to a friend and say, you know, you've been saying that I'm feeling and seeming different. Maybe this is the time to speak to someone. And it doesn't have to, you don't have to go to the full-blown psychiatrist that seems frightening. You start with a therapist that is sponsored through a church or sponsored through a medical community, and you might find just the right fit of somebody to talk it through, and then decide if there is appropriate medication to help, or can the conversation lead somebody to the plateau instead of the cave or the pit in which they find themselves. So I would invite people to do it. The cost is, well, our cost is nothing. And there are last thing I'll say on this is the medical communities have an encouraging factor on their board to be promoters of their services. So there are people at hospitals and others that have a whole team of people that want to go out and speak to communities and are waiting for the invitation. So we were able to set these up quite well and cover the gamut of somebody's emotional and spiritual and physical care. And so you may find that in your own community, whoever I'm speaking to right now.
Well, thank you for speaking to many people who will be listening to this down the road. And as someone who attended many of those early sessions of Body, Mind, and Soul, and was even asked to present some, I can testify to how meaningful they are and how gratifying they are all the way around. So thank you for today, and thank you for this ministry that you have championed for 20 plus years. I know it will continue to flourish, and as it does, benefit more and more people. So again, thank you, Jeff.
I'm pleased to be here, and I wish all who may be taking this on personally or corporately or religiously, God's blessings for the work that you do.